Neck pain relief exercises. Cervical spondylosis is a condition that causes deterioration of the vertebrae, discs, and ligaments in the neck or cervical spine. Other names are arthritis of the neck, cervical osteoarthritis, or degenerative osteoarthritis. The cervical spine refers to the 7 small vertebrae that form the neck. They start at the base of the skull. In cervical spondylosis, the edges of the vertebrae often develop bone spurs called osteophytes. Over time, the discs get thinner, and their ability to absorb shock is lost, increasing the risk of symptoms. Swollen neck joints, called facet joints, can press or pinch nearby nerve roots or the spinal cord itself, resulting in tingling or pins and needles in the extremities and sometimes even pain in the limbs. In some cases, there may be a loss of feeling and coordination. Some people may have difficulty walking. Most people experience degenerative changes as they get older. The AAOS add that over 85% of people over the age of 60 years live with cervical spondylosis. A person can ease the symptoms of cervical spondylosis with a few simple neck exercises. Neck stretch. Keep your body straight. Push your chin forward in a way that stretches the throat. Softly tense the neck muscles. Hold this for 5 seconds. Return your head to its center position. Push your head back with the chin held high, and hold for 5 seconds. Carry out 5 repetitions. Neck tilt. Tilt your head forward so that the chin touches the chest. Softly tense the neck muscles. Hold this for 5 seconds. Return the head to a neutral position. Carry out 5 repetitions. Neck tilt, side to side. Lean your head down towards either shoulder, leading with the ear. Softly tense the neck muscles. Hold this for 5 seconds. Return your head to the center and repeat on the other shoulder. Carry out 5 repetitions. Neck turn. Turn your head to one side as far as it remains comfortable, being sure to keep your chin at a level height. Tense your neck muscles for 5 seconds. Return the head to a central position. Repeat on the opposite side. Repeat this exercise 5 times on each side. These exercises can help to moderate the impact of the condition and alleviate pain or feelings of stiffness. However, they will not cure cervical spondylosis. Causes cervical spondylosis occurs because of long-term degeneration and wear and tear of the cervical spine. A previous neck injury may also lead to the condition. Some long-term activities may increase the risk of developing cervical spondylosis, such as carrying heavy loads, practicing martial arts, or being a professional dancer or gymnast. Some researchers say that there could be a genetic cause because the condition sometimes runs in families. It usually starts to appear after the age of 40 years, and it progresses over time. Men usually develop it at an earlier age than women. Smoking may also increase the risk. Treatment. Cervical spondylosis is usually symptomless. When symptoms do occur, they tend to resolve over time, often without treatment. If symptoms occur, treatment can help to reduce the impact. Muscle relaxants are useful if the person has neck spasms, in which the neck muscles tighten suddenly. Options include cyclobenzaprine and similar muscle relaxants. Antidepressants, such as amitriptyline, can sometimes help to relieve persistent pain that has not responded to other treatments. Gabapentin is another option. A steroid injection in the neck may help with very severe pain. Examples of steroid injections include a trigger point injection that can be done in a physician's office, a facet joint injection, a cervical epidural steroid injection, ESI, performed under fluoroscopy, with the help of an X-ray. Physical therapy can also help alleviate symptoms. Surgery. Sometimes, the symptoms of pain and stiffness continue to get worse, and nerve problems can occur. Surgery may be an option if the person experiences persistent neck pain that radiates down the arm, a loss of sensation, muscle weakness, a loss of bowel or bladder function. If MRI results indicate nerve root compression or pressure on the spinal cord, known as myelopathy, the individual may benefit from surgery. The surgeon may remove some osteophytes, or protruding pieces of bone, and possibly also portions of a disc to take pressure off the spinal nerve root or spinal cord. Another type of surgery is cervical fusion. This will reduce pressure on the root joints and the spinal cord. In most cases, there is just a pain in the neck, stiffness, and the occasional headache. Neck pain may spread to the shoulders, arms and hands, and the base of the skull. Moving the head may make the pain worse. Neck stiffness is more common after a long period of inactivity, for example, after sleeping. Headaches tend to start at the back of the head and then gradually move to the upper half of the front. Sometimes, these changes result in a compression of the blood vessels. This can affect the blood supply to the brain, possibly resulting in dizziness and even blackouts. Other, less frequent, problems may include loss of bowel or bladder function and coordination difficulties. Arms and legs may become weak, and there may be lack of dexterity. Some people may have dysphagia, or difficulty swallowing, if the bones press against the esophagus.